Which allergy medicines are safer if you have prostate problems? This video is for general information only and isn't a substitute for medical advice. Always speak to your GP or pharmacist for guidance that's right for you. Are allergy tablets safe if you have prostate problems? It's a really common question, and the answer depends entirely on which ones you choose. Many men with prostate enlargement don't realize that some everyday allergy medicines can actually make urinary symptoms worse. So let's break down what you need to know. Benign prostatic hyperplasia, or BPH, is where the prostate gland enlarges and makes it harder to pass urine. Certain ingredients found in common allergy and cold remedies can add to that problem significantly. The main ones to be aware of are first-generation antihistamines and oral decongestants. First-generation antihistamines, things like chlorphenamine and promethazine, have what's called an anticholinergic effect. In simple terms, they can reduce the bladder's ability to contract properly, making it harder to empty fully. The BNF, which is the reference guide used by UK prescribers and pharmacists, lists prostatic hypertrophy as either a caution or a contraindication for these medicines. So if you have prostate concerns, these are best avoided unless a healthcare professional has specifically advised otherwise. Oral decongestants are another category to be very careful with. Pseudoephedrine and phenylephrine, found in many combination cold and flu remedies, stimulate receptors in the prostate and bladder neck, causing smooth muscle to contract. This increases resistance and can make urination difficult or even impossible. Many products carrying these ingredients have cautions or contraindications in prostatic hypertrophy, particularly where there's a risk of urinary retention. Always check the full ingredients list on any cold or flu product before taking it. So what can you take safely? The good news is there are effective options. Second-generation antihistamines are generally preferred for men with prostate enlargement. Cetirizine and loratadine are both available over the counter in the UK and are recommended by NICE for allergic rhinitis. They have minimal anticholinergic activity, meaning they're much less likely to interfere with bladder function. Other second-generation antihistamines, such as fexofenadine, bilastine, and levocetirizine, are generally considered suitable as well, though some may require a prescription or pharmacist guidance. It's worth noting that urinary retention has very rarely been reported, even with second-generation antihistamines in men with severe bladder outflow obstruction, so it's always sensible to check with a pharmacist or GP first. For nasal symptoms like hay fever, nasal corticosteroid sprays, such as fluticasone, mometasone, or beclometasone, are actually recommended as first-line treatment by NICE. They act locally in the nose with minimal systemic absorption and aren't expected to affect the prostate or bladder. They tend to work best when started a couple of weeks before your hay fever season begins, rather than waiting until symptoms are already in full swing. If you're already taking medicine for your prostate, such as an alpha blocker like tamsulosin or a 5-alpha reductase inhibitor like finasteride or dutasteride, it's especially important to speak to your GP or pharmacist before starting any new allergy treatment. One more thing, if you find yourself completely unable to pass urine at all, that is a medical emergency. This is called acute urinary retention, and it requires immediate hospital assessment. Don't wait. Seek emergency care straight away. And if your urinary symptoms worsen after starting any new medicine, stop taking it and contact a healthcare professional promptly. To recap, first-generation antihistamines and oral decongestants containing pseudoephedrine or phenylephrine should be avoided if you have prostate concerns. Second-generation antihistamines like cetirizine and loratadine are generally preferred as first-line options. And nasal corticosteroid sprays are an excellent choice for nasal allergy symptoms. Always check the ingredients list and the patient information leaflet of any product, and speak to your doctor or pharmacist before starting something new. If you found this helpful, leave a comment below. We'd love to hear your questions. And if you want more straightforward health information like this, make sure you like this video and subscribe to the Bulk Pharmacy channel.